Let's talk a little bit about anatomy of a tooth. There are three layers of tooth structure. The outer layer is the part that we see. The part above the gum line is its enamel and covers the entire outside of the tooth above the gum line. That's the hardest substance in our body, harder than bone even, which is why they use it to do CSI forensic stuff. The second layer of tooth, and by the way, enamel has no feeling whatsoever. It's kind of like your fingernail. It's very, very hard, but no feeling. The second layer of tooth structure is much more yellow in color. It's called dentin, and of course it's much softer as well, and that makes up the bulk of our tooth. And the third layer is the pulp chamber, and that's the uppermost portion of the root canal system. That's where our nerve and blood supply are housed. And if anything communicates with that, there's definitely significant pain and discomfort, and we want to avoid that if at all possible. Cavities actually, what happens is bacteria are the plaque is laden with bacteria, and those bacteria, as they feed and grow, produce acids which destroy the enamel and the dentin. And as it destroys some of the tooth structure and penetrates deeper into the tooth structure, that hole gets bigger and bigger. So it starts off as something really, really small, destroying some of the enamel. Sometimes it destroys a little bit of the enamel, and because dentin is 7 to 8 times more susceptible or softer, once it breaks through the enamel, then it spreads rapidly into the second layer, or dentin. And of course we want to avoid it involving that third layer, because then we get into much more invasive treatment or much more complicated treatment, more time, more energy, more money. So we always want to try to discover cavities at their earliest stages, because it's much easier to deal with a problem when it's small. You really want to not wait until that problem turns into Godzilla and can destroy cities. You want to get it when it's a small thing and you can just kind of stamp your foot on it. It's much easier to deal with. So the earlier you detect these things, the easier it is to deal with. Of course, once you've got a cavity, the proper treatment is to remove any of the unhealthy tooth structure and make sure that all the sound tooth structure stays present and then is restored. And a restoration or filling, to fill the hole, or cavity, fancy word, it's a simple procedure, and it shouldn't hurt at all. What is usually done is that area or that tooth is made numb so that you're comfortable and don't feel anything during the procedure, and then it's restored back to its natural shape and form. The best scenario, of course, is to prevent cavities from happening at all. Some of the things that we can do is brush twice a day, floss once a day, because the floss can get in between your teeth where the toothbrush bristles can't fit. And again, seeing your dental professional on a regular basis, because even if you're brushing twice a day and flossing once a day, you cannot reach more than 2 millimeters under your gums, and your dental professional, of course, can reach between your teeth and under your gums to remove the plaque, the tartar, and the stain. So doing proper home care and occasional preventive care at the dentist, that will keep you out of trouble.